Thank you very much for staying with us. The Chief of Field Services and Coordinator of the United Nations Children's Fund in Nigeria is worried that the Sustainable Development Goals will not be achieved in the country until issues concerning children are addressed. Annefrida Kisesa-Mkusa was speaking at the UNICEF's annual review meeting in Yola, Adamawa state capital, where she noted that Nigeria accounts for 11% of the total population of children in the world and 30% in Africa. This is a statistic that underscores the need for stronger collaboration between government and development partners. Yola filed in this report.
Gathered in this hall are health personnel, NGOs and government officials from Taraba, Gombe and Adamawa states. The forum is designed to enable participants evaluate UNICEF's performance in the past year and define goals for 2020. It is also believed that fresh partnerships are needed to resolve issues relating to children.
And then we will be working with these government agencies and ministries and other partners who are in the same area, trying to help the state government to implement these programs more effectively and efficiently. So UNICEF is there always to support. We do not have a separate plan as such. We support the government plans and programs. And then we discuss with the government if there are issues, technical issues. If there is something wrong, we also bring out that issue. We don't keep ourselves quiet.
Data presented to participants by UNICEF's planning and monitoring specialist, Stili Garuba, shows fresh strategies are needed to reduce infant mortality and increase school enrollment by children in the 3 states.
So the challenges that we have identified during this meeting, we are going to meet with our stakeholders and our community leaders at the community level to brainstorm on how to improve the indices of Adamawa State by next year.
There are areas that actually needed to be improved upon. For instance, if you see the area of nutrition, even the data we have, which we said has improved, we need to also work harder on it to make sure that it is reduced to the barest minimum. Like for instance, the out of school children, like even the maternal death, we need to improve upon. And also even the delivery in health facilities, as we look at the data, we need to work on it.
There are some areas that we have not fully achieved, especially in the area of training of health workers, volunteers. We did not fully achieve those areas. So for the nutrition sector, we will try to make sure that in the planning of 2020, we will put those areas, we will improve in those areas, especially those areas that needs release of funds.
The fund says that it aims to focus next year on a number of key areas for the 3 states, ranging from reducing infant mortality and maternal mortality rate to implementing health nutrition, water sanitation and hygiene. It also hopes to improve access to quality education and gender equality, with an emphasis on increasing primary school enrollment and retention, particularly of girls and children from marginalized and vulnerable groups.